you doing, everyone? I'm Dr. Ray. This is Dr. Ian. We're at Bradford Family Chiropractic. We're going to do a quick little review on carpal tunnel today. We'll also show you a couple of orthopedic tests that we can do to test out for carpal tunnel. So we're going to look at carpal tunnel. What we're looking for specifically, symptom-wise, would be numbness and tingling into the wrist and into the fingers, specifically 1 finger, 2 finger, 3 fingers. That's going to be the region of numbness and tingling. This can be complicated by other underlying situations, pregnancy, hypothyroidism, just to name a few situations that might progress carpal tunnel. It's usually going to be more symptomatic in the patients that are more using their hands more frequently. People that are on the computer a lot, holding their iPads a lot, hand workers will be more prone to it than others. So symptomatically, numbness and tingling into these 3 fingers. If you're having pain in just one generalized location and it's not causing numbness and tingling, it's less likely to be carpal tunnel. What typically happens is the median nerve, as it travels through this region, gets impinged, possibly by a carpal bone. So there will be possibly chiropractic adjustments we can do to take the pressure off of that median nerve. Other times it gets entrapped under this carpal ligament, this transverse carpal ligament that kind of runs where my fingers do. So one test we would do in an office like ours would be what's called a durkans test, where we're going to try to grab a hold of that median nerve as it travels through that carpal tunnel, right past our transverse carpal ligaments. We're going to put our little fingers down and we're going to see if we can press on the median nerve, and we're going to put a little extra pressure on it for upwards of 30 seconds to a minute. And if this little pressure test, this median nerve compression test, which is another term for durkans test, if this produces the same symptoms the patient's having, so does that make your fingers numb and tingling when I do that? If this doesn't cause any problems, it's a strike against carpal tunnel. If it does cause and reproduce the same symptoms, it's maybe a step towards us believing this is carpal tunnel. Now we can follow this up with another old tried and true test called phalens test, where we have our patient put their hands in reverse prayer position. And we're going to hold up here, again, compressing the median nerve pathway, and we're going to hold that between 30 seconds and upwards of 2 minutes, looking to see if we can reproduce the same symptomatology. Again, that symptomatology, if you bring those hands down, would be numbness and tingling on the palmar side of the wrist between the first, second, and at least the inside portion of the 3rd digit. Again, these were carpal tunnel tests, durkans test, and a phalens test for carpal tunnel. Thank you.